Good afternoon. Good afternoon. Okay. So today we will see about the facial palsy. Okay. So facial palsy. அப்படினா என்ன? உங்களுக்கு என்ன தெரியும் facial palsy? So facial is either parallel or unparallel. So it's a parallel. So ரெண்டு சைடுமே வந்து என்ன சப்ளை இருக்கு? facial nerve சப்ளை இருக்கு. So facial nerve நேம்ல என்னவா இருக்கு? facial nerve. அப்ப எந்த மசிலுக்கு சப்ளை பண்ணும்? So facial muscles. So facial muscles inga what are the facial muscles you know? So come this. What are the facial muscles you know? So what muscle name it is? Corrugator, frontalis, then orbicularis, oculi, orbicularis, oris. This two part is orbicularis, oris, masseter, then mentalis, then buccinator will come around this area. Okay, so these are all the facial muscles. So what are the actions of facial muscles? So facial expression. So facial expression includes eyebrow movement, eye opening and eye closing movement, lip opening and lip closing movement, then swallowing movement, or chewing movement. So இதெல்லாமே சேர்ந்தது என்ன? Facial expression or facial muscle oda action. So when facial nerves get involved due to any neurological condition or exposure to the cold climate. So எதனால cold climate exposure ஆனால facial nerve involvement ஆகுதுன்னு சொல்றாங்க? Any idea? So due to exposure to the cold climate, the chillness will enter to the ear and it will affect the facial nucleus, which is located inside deep to the ear ossicles. Okay, so which affects the facial nucleus, which tends to involvement of the facial nerve, and then there will be a paralysis of facial expression. So facial nerve palsy patient, what are the chief complaints will present in the facial nerve palsy patient? So the loss of facial expression. So patient can't be able to close his eyes completely. So patient will close only half of the eye, not there won't be closure of the complete eye. Okay. Then when the patient when you ask the patient to smile, means patient can't be able to smile completely. One side of the muscle will become deviated. So and the deviated eye also the side of the muscle means normal muscle. Due to the contraction of the normal muscle, due to paralysis of the affected side muscle, inga paralysis ஆயிடுச்சு, contraction நடக்கல. So over contraction of the opposite side. So என்ன ஆயிடும்? It will goes to the deviation of the stronger side or normal side. Okay, so என்ன மாதிரி treatment we can give for facial palsy? So we can go with the stimulation. So in the stimulation, can be able to give directly facial stimulation over here? கொடுக்கலாமா? So because the muscles are smaller muscles compared to the upper limb muscles and lower limb muscles, yes or no? So we can give galvanic stimulation over the muscles area, then followed by we can give valve stimulation to the nerve trunk. So how much trunks present in facial nerve? 3 trunk. So upper trunk, middle trunk and then the lower trunk. So upper trunk is responsible for the upper facial expression, middle trunk is responsible for the middle facial expression, lower trunk is responsible for the lower facial expression. So first we will give galvanic stimulation to the muscle area, followed by we will give valve stimulation to the trunk area. Okay, so for muscle stimulation we can choose galvanic stimulation, and then how much stimulation we can give? 30 visible contraction. 30 visible contractions. Okay, shall we see? So for that we can choose galvanic stimulation. So galvanic stimulation consists of what kind of electrodes? Active pen electrode and then the inactive pen electrode. So inactive pen electrode, where we can fix this inactive pen electrode over the nape of the neck. Okay. So you know how to assess the nape of the neck. So after assessing the nape of the neck, it will comes around C7 vestibular region. So after attaching the inactive electrode, then we will go with the galvanic stimulation. So once starting the stimulator, what we have to notice, whether it is in Faraday type of current or galvanic type of current. So I am changing to the galvanic type of current. Okay. So in this there are type of the we can set the duration over the either 3 or 1. Okay, you can set over the duration over the 1 or 3. Okay, then automatically we are choosing the muscle. So now we are going to see the frontalis muscle. Okay, ask the patient to be relaxed question and not patient should not close the eyes. Patient should open the eyes. Okay. Then after placing the inactive electrode, start giving the intensity. So when we have to raise the intensity during the contraction. So before that we have to choose whether it is the plain mode or intermittent mode. Okay. So for gyro stimulation we have to give intermittent mode, not the plain mode. Okay. Now I am raising the intensity. If you feel any discomfort, you can say me, sir. Be relaxed. Are you seeing the visible contraction over the eyebrows? Eyebrow raise side So this is the visible contraction. So like that we want to give for 30 visible contraction. So 1, 2, 3. Like that we have to give 30 visible contractions. So this is for muscle region. So then for trunk region, which kind we have to choose? Galvanic or Faraday? Faraday type of current. Okay. So Faraday la vandu enga pathom trunk la vekrom seriya. So trunk la vekrappa after raising the intensity fullave vandu contraction feel agudha one side of the muscle. So instead of the muscle contraction feel so it 60 seconds or 1 minute. So galvanic now visible contraction, paralytic now 60 seconds or 1 minute. So now I am placed in the middle trunk. So we can either go with upper trunk, middle trunk or lower trunk. It's individual trunk region, or otherwise we can give over the common point which is below to the ear. Okay. So this is the common point which involves all the 3 trunks. Okay. So is it clear?
Yes, sir.
So the facial calcification on the confidence and engagement.
Yes, sir.
Okay. Thank you.
Thank you.